Welcome to Public Health IT. This will be a lecture on the potential of public health information technology for health promotion and chronic disease prevention. The learning objectives for the potential of public health information technology for health promotion and chronic disease prevention unit are: Number 1. Describe and categorize issues, questions, data sets, and factors, variables that are used in descriptive epidemiology. Number 2. Describe how evidence-based recommendations may be appropriately used in implementing and evaluating health promotion and disease prevention. Number 3. Describe the different types of health promotion and disease prevention and different methods of enacting health promotion programs.
4. Identify the steps in the process of implementing and evaluating prevention programs and interventions. 5. Identify the clinical preventive services that are linked to health promotion and disease prevention. 6. Describe how informatics can be incorporated into clinical preventive services. 7. Describe the history and foundation of geographic information systems and explain its role in evidence-based practice. 8. Identify the barriers to incorporating public health IT into clinical practice and potential methods for resolving these limitations. 9. Identify the existing and innovative methods for communicating and sharing health information with the public. To begin, let's review a component of epidemiology known as descriptive epidemiology. Descriptive epidemiology focuses on the pattern and frequency of population-level health issues. This allows further analysis of the distribution of health outcomes within a community and within larger populations. Identifying and reporting on the pattern and frequency for disease leads to an understanding of potential causes for disease, as well as other health issues. For example, the descriptive reporting injuries enable a better understanding of interpersonal violence as a health issue affecting the public. With an improved understanding of domestic violence, strategies can be identified for developing interventions to assist and educate survivors of domestic violence. To analyze and identify the distribution of health conditions within a community, we need to ask a series of questions. These questions help to describe the health issues occurring within a community and also document the numbers and rates of health problems for a population. The questions that are often asked are: how much deals with frequency, when, time, where, place, and among whom, person. There are several dimensions of the health conditions that occur, and these dimensions help us to identify when the problem is happening, where the problem is happening, and who the problem is affecting. The time, place, and people involved in describing the health problem is necessary to interpret the patterns of disease so that we can begin to develop ideas as to why the problem is occurring and how to prevent or reduce the health issue. How much is the question we ask to identify the frequency and pattern of disease amongst a population. The data sets that we need to analyze the frequency and pattern of disease include examining both the burden of disease as well as the course of disease. The burden to the population can be explained by the morbidity and mortality caused by the health problem. Morbidity is the portion of the population that is affected by the health issue. For example, morbidity for the swine flu during April 2009 would enable us to examine the severity of the disease within the population. Mortality is the proportion of the population that has died due to disease or other health problem. Again, mortality enables us to perceive the severity of the disease within a population. The Centers for Disease Control and Prevention, or CDC, produces a weekly morbidity and mortality report, which enables the CDC to provide accurate and timely data for use in public health prevention programs. In looking at the course of disease within a population, we need to look at incidence, prevalence, and case fatality. This enables an examination of the pattern of disease by looking at the health status of individuals, or case reports, within a population. Incident cases represent the change in health status of a person from well to sick or from alive to dead. Prevalent cases represent the existing health status of an individual, such as well, ill, alive, or dead. Case fatality represents specifically the death of an individual. It is important to keep prevalence and incidence separate when conducting epidemiological studies. Incidence rates are important in understanding new cases of diseases, and prevalence rates are important in understanding existing cases of diseases. When describing the distribution of disease, it is important to focus on the dimensions of the data available to use in epidemiological studies. Let's look at the dimensions of person, place, and time in more depth here. Time represents the change in disease occurrence, such as the characteristics of disease occurring during an epidemic, or more simply, the characteristics of the flu during the winter months. Place represents the geographical location that is limited by boundaries, such as a state within the United States or a country. Place can also refer to a building, room, work site, school, a well, or mountain. Basically, place represents the spatial location of the health problem. Person represents the characteristics of a population affected by disease. This can include socio-demographic characteristics as well as behavior. For example, we may examine a population that has reported usage of tobacco to analyze lung cancer. In order to conduct studies in descriptive epidemiology, we need to be able to obtain data that helps us to identify morbidity, mortality, incidence, and prevalence of disease. Some sources of data include epidemiological databases and registries that are developed and published by local, state, and federal agencies. This data provides vital statistics on the population, as well as active and passive public health surveillance. The health research of descriptive epidemiological studies is based on systematic research methods and principles. There are different study designs that may be used in this health research, such as surveys, descriptive studies, longitudinal studies, observational studies, and randomized clinical trials. This study design is used to estimate the magnitude of the association between the disease and potential causes or determinants of disease. This estimation can include a relative risk/odds ratio, attributable risk percentage, number needed to treat, and population impact measures. These calculations then help to identify the statistical significance of research results, with the statistical significance of research results falling within or outside of confidence intervals. In examining the association between disease and potential causes, the study design must identify potential confounding and interaction variables that may influence research results. Finally, one component of health research that is not well understood is how to present your research results so as to make them understandable to a wide audience. This is dependent on the quality and presentation of your data, including the accuracy and precision of your research results, and then the use of visual aids when communicating with others. A goal of research is to understand the risk factors associated with diseases and populations at risk so preventive strategies can be developed and implemented. If that goal is not obtained, hopefully the research enhances the existing body of knowledge and provides a direction for future research. Evidence-based practice is increasingly relied upon for evaluating and improving patient care. By looking at health outcomes in patients that are seen in clinical care, we can build a knowledgeable base of evidence for diagnosing patients and developing appropriate health interventions. Evidence-based practice can improve the effectiveness of patient care and at the same time reduce the costs in healthcare systems. This knowledge base derived from evidence-based practice is a growing movement in medicine and public health that is now a requirement for obtaining funding for research. The effects of improving patient care based on the observations and improvements of patients in clinical practice can be disseminated into the community through programs for health promotion and disease prevention. This dissemination of these programs helps to positively impact health behavior in the community to reduce or prevent disease. Recommendations based on evidence-based practice are used to influence change in health behavior in the community. These recommendations include assessing the quality of the evidence in health research and assessing the magnitude of the effect for change in health status for the population. The combination of these two assessments helps to communicate the likelihood of success for implementing programs in health promotion and disease prevention. Now let's look at the different types of strategies for population-level health prevention. Primary prevention is composed of protective activities to help prevent disease as well as the promotion of health behavior in the community. Secondary prevention is composed of activities to intervene in health issues at the earliest stage possible. Tertiary prevention is composed of treating disease or other health issues to improve the quality of life for people with disease. Data collected on chronic diseases or health status in the United States has an impact on the type of prevention developed. Let's look at adult-onset diabetes. It is well known that aging, obesity, limited physical activity, and unhealthy eating habits are risk factors associated for adult-onset diabetes or non-insulin-dependent diabetes. Primary prevention would include encouraging people to be physically active, eat healthy, and educate them regarding the different types of diabetes and signs and symptoms of diabetes. Secondary prevention would educate individuals about recognizing the signs and symptoms of diabetes, being tested for diabetes, management options via medication or diet, monitoring glucose levels, and recommendations to increase physical activity and eat healthy. Tertiary prevention would focus on management of individuals with diabetes via oral medication, monitoring glucose levels, eating healthy, importance of screening for eyes, being physically active, foot care, and being educated regarding the common complications associated with the disease. In developing programs in disease prevention and health promotion, the target population needs to be identified to understand the needs and characteristics of the people that we are trying to impact. This target population could be individual patients, groups of people that are at high risk for disease, or other health problems, and large populations, such as the community living within densely populated cities such as New York City. The question of how to intervene through health prevention strategies is an important one that involves defining the methods that could be used to influence change. Education is one method for positively influencing changes in health behavior in a population. Also, there could be incentives for behavior change, such as providing shelter for the homeless who are drug users and who are attempting to quit, and provide tactics on how to manage relapse and prevention. There also may be opportunities in changing laws and policies within communities to effect change. Engineering innovative approaches to solving health issues may involve thinking outside of the box and using new technologies to communicate about and influence behavior change in multiple communities of people of varying ages and backgrounds. We will examine new technologies in health promotion and disease prevention further on in this unit. Identifying strategies, the target population, and the types of methods to be used for health promotion and disease prevention helps us in implementing programs to prevent and reduce health issues. Once we've implemented programs, we need to continually evaluate these programs to be able to apply everything we have learned into new and future recommendations. The evaluation of health promotion and disease prevention programs involves an iterative cycle of quality improvement and assessment of patient safety. Also, we need an assessment of the health outcomes resulting from such programs, as well as a continuous round of assessing and reassigning remaining health issues. The first half of this unit has served to lay a foundation for understanding the methods and principles of health promotion and disease prevention. Now we will transition to what health promotion and disease prevention entails. Let's start by talking about clinical preventive services. Clinical preventive services are the methods and tools used in clinical practice to help positively influence the health status of the population as a whole. These are primary prevention strategies which include screening for health issues, counseling for behavior change, immunization, and preventive medicine. Other interventions include shared decision-making in healthcare and improving risk comprehension in patients that may be at risk for disease. This may include examining health literacy and competency in patients to improve the communication of complex health information between clinicians and patients, to empower the patients to share in decision-making. Let's examine common characteristics between these clinical preventive services to better understand how to identify and develop needed programs in health promotion and disease prevention in public health. The assessment of health risks helps to understand the potential causes for health issues occurring within a population. Screening is one direct method for assessing these health risks, and these risks include biological, psychological, social, and environmental factors. The communication that goes on between clinician and patient is important to all preventive services. The clinician has a direct connection to influencing the patient to understand health risks, as well as opportunities for health behavior change. This communication includes increased patient participation in health-related decision-making. Also, health research is dependent on patients agreeing to be included in studies to improve public health. The clinician-patient relationship is vital to increasing patient participation in health research via informed consent. Additionally, patient advocacy is an important mechanism for change in the community. Health literacy is ensuring that the patient understand the health-related information given to them in order for them to make a decision regarding their health outcome. Communication with the patient needs to incorporate educational aids to improve the understanding of patients regarding his or her health issues. One of the benefits of utilizing technology to store past and current medical history is the fact that the information will be documented. It's not uncommon for people to forget surgeries, allergies, or tests conducted. The PHR provides a method of storing that information and having it accessible when needed. There are numerous benefits to PHRs. The most obvious is that information is preserved. Also, the availability of the information assists the physician in the decision-making process. There is no delay in waiting for records to be copied and sent. The record of tests previously performed reduces the likelihood that they will be duplicated. Another benefit is the management of chronic diseases. Diseases such as diabetes, obesity, and high blood pressure, requiring monitoring of glucose levels, weight, and blood pressure. These values could be communicated via the PHR to the physician. If the values require further attention, the physician can contact the patient with instructions. This type of monitoring and communication with the physician can limit delays in treatment. There is a variety of different options for consumers to choose regarding PHRs. There are many different styles available on the Internet. Consumers should choose the option they feel most comfortable with. Obviously, the web-based options are beneficial for individuals who travel, as the information is available wherever there is access to the Internet. Individuals should take the necessary security precautions if accessing their PHR in public, and be careful who they allow access to their PHR. The American Recovery and Reinvestment Act of 2009 listed three main components of meaningful use. The first was the use of a certified EHR in a meaningful manner, such as e-prescribing. The second was the use of certified EHR technology for electronic exchange of health information to improve quality of healthcare. The third was use of certified EHR technology to submit clinical quality and other measures. The evolution of meaningful use will continue to progress with technology. Although the PHR is not an EHR, it can be utilized in a meaningful manner to enhance the quality and delivery of healthcare services by making patient information available instantly. There are a wide variety of approaches in implementing and conducting clinical preventive services. For screening of disease, there may be a range of normal test values depending on the health issue being screened. Diverse patient perspectives must be incorporated into counseling for behavior change, which includes training counselors to assess and include patient values as basic counseling skills. With immunizations, the manner in which vaccinations are administered may vary. There may be a target population for specific vaccinations, or immunization for disease may be administered to achieve population-level immunity, such as with measles. Preventive medication is typically time-based, with a focus on preventing disease before or after exposure to potential determinants of disease. For example, chemotherapy is a type of preventive medication in which chemo is administered in timed intervals to achieve maximum effectiveness against recurrence of cancer. Other preventive interventions may utilize approaches such as promoting diet, exercise, or smoking cessation. Evaluation is required in health research, including clinical preventive services. Evaluation includes assessing the effectiveness of the service in preventing the targeted health problem from occurring or reoccurring, and examining both the benefits and the harms resulting from the administration of preventive service. In addition, the evaluation should include barriers to implementing clinical preventive services. Barriers may include the costs involved in training, administering, implementing, and evaluating such services, as well as patient acceptance or rejection.
A public health framework for developing programs for health promotion and intervention includes 4 stages. First, define the problem. Second, identify the risk factors. Third, develop and test interventions. Fourth, ensure widespread use. We discussed these stages previously and examined the foundation for descriptive epidemiology for defining health problems. We have looked at descriptive epidemiology as the foundation for defining a health problem and for identifying potential factors contributing to the problem. We have also discussed developing and evaluating preventive services, specifically within clinical care. To incorporate these preventive services into a wider public health model, we need to ensure that the adoption and evolution of these services into larger programs for health prevention and promotion occurs. However, we cannot assume that interventions that are effective and successful are adopted into the field. There are different methods for developing public health interventions, such as intervention mapping. The 4 stages described involve literature reviews, theoretical frameworks, understanding the target population, developing and testing of hypotheses, program development, implementation, funding constraints, and political influence. One of the benefits of utilizing evidence-based research is that it has been shown to be effective, which increases the likelihood of it being replicated.
How do we achieve widespread use of effective interventions in public health? A framework developed by a team of researchers led by Wandersman attempts to answer this question. This framework defines innovation and how it is applied in health prevention and promotion. Synthesis and translation of innovation must occur initially before the supportive prevention systems can be defined. Lastly, implementation of innovations into the field is defined within this framework to ensure widespread use. The framework is intended to be applied to the types of innovation used in prevention programs. In the context of this framework, innovation is intended to mean programs, policies, processes, and principles used in the implementation of health prevention. To ensure that innovation is successfully disseminated and implemented, the information used within the programs, policies, processes, and principles of health prevention must be understandable and usable to a wide audience of users. Synthesis of this information is the process of compiling and summarizing innovation through a number of methods. Translation is the process of converting knowledge from science, specifically health research results, into a tool that is easy to use. When discussing innovation, we need to ensure that the developers of these systems of health prevention work together with its intended audience or target population. To support the work that goes on between developing innovation and implementing prevention systems, the development and support of new skills must occur. The people using these systems need specialized training, coaching, supervision, and ongoing monitoring of the work that occurs to ensure fidelity or adherence to the prevention's principles and policies.
As medicine changes, public health must change with it. In the beginning, knowledge regarding how HIV was transmitted was not known. Today, we are aware of how it is transmitted, and many public health programs incorporate that knowledge into prevention programs.
Implementation of health prevention systems need to consider multiple factors to ensure widespread use. First, the environment or practice setting in which a system is to be adopted is important in understanding the actions needed to successfully implement such health prevention innovations. This may be organizational settings or community-level settings, such as the state or national levels. The education levels, experience, and attitudes of the individuals responsible for implementing innovation must also be considered because these characteristics influence the success or failure of widespread use of health prevention systems. Individual, organizational, and community-level factors all may affect the implementation of these programs. Interactive health technologies are a specific type of innovation that may be used in health promotion and disease prevention. These technologies enable individuals to interact with computerized interfaces in order to obtain, process, and apply health information. Interactive health technologies have been used in promoting behavior change in patient populations with diverse educational and economic levels. In order to provide an interactive experience for the patient, the designs of these systems are centered on the needs of the user. The users of these systems are not only patients, but also consumers, caregivers, and professionals. It is pertinent to involve users in the design and development of computer systems to help ensure that users accept and use these technologies. To influence health behavior change, it is vital that the intended audience, the target population, uses the system, and you need to make sure that they want and can use the system. The Children's Partnership has utilized technology to develop games targeting children. The outcome expectations include increasing knowledge, improving healthy eating, and increasing physical activity. Interactive technologies have also been developed for therapy and rehab. The links to these resources is available on the reference slide at the end of the presentation. Geographical Information Systems, GIS, is an existing technology that can be used in both health research studies as well as in the health prevention and promotion programs designed on health research results. GIS is a combination of the sciences of geography, cartography, statistics, and computer science. These systems allow us to analyze the spatial distribution of resources and people that factor into health problems. Moreover, potential determinants of health problems can be determined by analyzing the pattern and distribution of disease amongst a population using geographical information systems. The increase in information volunteered by users of the Internet also facilitates health research using GIS tools. This volunteer geographical information has the potential to help bridge the current limitations of current GIS studies of disease.
Many states have incorporated this technology to understand populations and resources. For example, Georgia has a mapping tool that can illustrate the number and location of emergency department visits. A spike in visits in one county may be an indication of an outbreak of an infectious disease. A list of websites is provided on the reference slide at the end of this presentation.
Different forms of media communication can be used in communicating and sharing health information with the public. This includes providing the public with information on the risk for disease. There are different strategies for using mass communication based on previous research in marketing consumer products. Constructing influential messages tailored to target populations can help in improving health behavior. There is opportunity in using newer technologies, such as with text messaging and online videos, to communicate with the public in health promotion and disease prevention. However, all communication needs to consider the literacy levels of the target population to ensure that patients understand the information provided. Health promotion and disease prevention programs need to consider the various perspectives of population health, such as environmental health, occupational health, and the impact on global health issues as well. Environmental health is concerned with health risk assessment and risk management based on potential exposures to environmental contaminants or biological determinants of disease, such as genetic mutations. Occupational health is concerned with work-related health risks and injuries and focus on methods for preventing and controlling occupational exposures and safety hazards. Global health issues include the effects of globalization on the health of populations in developed and developing countries. These global health issues include emerging diseases and limitations to food and water supplies. Cultural values are an important aspect to health promotion and disease prevention that needs to be considered in the delivery of health services in clinical care. Preventive systems need to be culturally appropriate and sensitive to the target population. Lastly, community preventive services are an aspect of population health that provides a direct line to the susceptible population. Programs include clinical preventive services that we previously defined and examined, but also methods for providing access to mental health care services and for public health preparedness in natural disasters and terrorist attacks. In developing and implementing health prevention systems, we need to consider challenges limiting the adoption of these programs and policies into the community. These challenges include legal and ethical issues involved with implementing services, as well as the privacy of patient health information. If research is being conducted, agencies must comply with a common rule and treat patients with respect and inform them they are subjects. The privacy and security of medical information, which can be utilized to discriminate against an individual, for example HIV status, must be protected. The use of IT for public health must ensure security of patient information. One topic that comes up repeatedly is health literacy. The ability to obtain, process, and apply basic health information services in health-related decision-making cannot be overestimated. Populations susceptible to disease that require assistance in health promotion and disease prevention are comprised of individuals with varying levels of education and literacy skills. To ensure widespread comprehension of the information provided by these programs, the developers of such systems need to understand the educational needs of the target audience. A consistent barrier to developing preventive services in public health is funding. Public health professionals need to be creative in developing programs that are sustainable. To conclude this unit, we will now discuss a few of the future innovations that are currently being explored in health promotion and disease prevention. Genetic testing to calculate risk for disease is a rapidly growing field that allows the medical community to test the DNA of individual patients. The results of genetic testing may help in communicating to patients regarding their risk for disease and subsequent medical options available to those patients in managing that risk. Spoken dialogue systems provide the opportunity to communicate with a more diverse population and can help to improve communication to communities in which health literacy may be an issue. Virtual health agents are software programs that may be configured to specific patient characteristics to help search and organize health information for individuals.
Personal health records, PHR, allow patients to store their health information online, but also provides the opportunity to utilize the PHR as a tool for monitoring chronic diseases and communicating with physicians. Telemedicine is the electronic exchange of medical information to improve patient health. Examples include video conferencing, transmission of still images, e-health via patient portals, remote monitoring of vital signs, and continuing medical education.
Location or mobile services may provide the ability to pinpoint the moving locations of individuals. Mapping the daily lives of individuals susceptible to disease may help to understand underlying causes or exposures that are not visible in current research technologies. However, privacy and security issues may limit the viability of such studies in research and in practice. Crowdsourcing is the task of outsourcing activities to external groups or individuals. The concept is that the wisdom of the crowds is greater than the wisdom of individuals. Challenge.gov is a website set up by the government to use crowdsourcing to help in solving health problems with the idea that the government and the public may solve problems together rather than separately. This website taps into the very idea of using public health informatics to promote healthy behavior and reduce or prevent disease. These agents can act as intermediaries that help to navigate an increasingly complex repository of health information available online and in clinical systems. This is the future of public health. This presentation discussed how epidemiology utilizes individual patient data to understand diseases that impact populations. In utilizing the abundance of data sources and technology available, public health professionals can understand the risk factors associated with diseases and the incidence and prevalence of diseases in populations. Based on incidence and prevalence rates, the appropriate type of health prevention, such as primary, can be developed and implemented.